want to thank one of my subscribers, Erica J., for sending this article. As opioid crisis rages, cost of overdose antidote spike. So if you want Narcan, you're going to have to pay more now. You see how they price gouge and take advantage of people going through a tough time? But this is what happens in America all the time. So I'm going to go ahead and play the video.
Investigation uncovered a medical scheme that targets opioid addicts. More than 600,000 people in the U.S. struggle with opioids. The president signed legislation this year that devoted more than $3 billion to fight opioid abuse. Some recruiters are using cash apps like Venmo to pay struggling addicts hundreds of dollars to get a surgical implant that promises to curb opioid cravings. Doctors then bill insurance companies thousands of dollars for the procedure. CBS Evening News anchor Jeff Glor spoke to one mother whose son fell victim to the scheme.
He said from the very, very first time I used heroin, the very first time, he said I was hooked.
In March 2016, Debbie Berry of Ashland, Missouri, got a text from her 22-year-old son, Brennan, that no mother wants to receive.
He texted me and said that I have a drug problem, Mom. I'm in trouble.
Desperate to help her son, Berry got him into treatment in California. One day, he called her from a doctor's office to tell her he'd found something to help.
He said, I'm going to get an implant put in. I'm here with them, and they've done a pre-certification that your insurance will pay for it.
It was an naltrexone implant, a small pellet inserted near a patient's abdomen. It releases medication that blocks the brain's opiate receptors. So if Brennan used heroin, he would not be able to feel the effects.
He was so adamant about how much it would help him.
Did you know he was getting paid for it?
I absolutely did not know he was getting paid for it.
A CBS News investigation has found vulnerable addicts like Brennan Berry are being paid hundreds, sometimes thousands of dollars in cash to get this 30-minute outpatient procedure.
You don't give a drug addict cash money.
Industry insiders tell us doctors can make up to $30,000 for each simple surgery. And the money is so good, some doctors hire marketers. And some of those marketers employ recruiters who lure patients with cash. We found a recruiter calling himself Carter on Craigslist.
Oh, hey, I was looking for Carter.
And we arranged to meet him at a Hollywood grocery store posing as a potential patient. He told us the implant had saved his life.
I had a heroin addiction about 4 years ago.
Yeah, it's bad.
I was on and off, but I'm over a year clean now because of this implant.
And as long as insurance would cover it, he'd pay us cash too to get one.
I'll pay about $750 for that.
$750?
$750.
He told us he'd get us the cash the day of the surgery, either by hand or via cash payment app.
Yeah, I can bring it to you.
Yeah.
I can bring it to you.
Just
that, Venmo, Cash App.
Oh, Venmo?
Yeah, however you want.
He showed us a payment he'd made to a patient the day before.
She got an implant, but she just didn't really know any better, so I just...
Oh, and you're a rent?
Yeah. I always say rent. Yeah, if you look at my Venmo, you'll see how many people I pay rent to.
Right.
Carter mentioned a doctor in Beverly Hills who he claimed had made a lot of money doing the implant surgeries.
His name was Dr. Rosen, Dr. Randy Rosen.
The same doctor, it turns out, who did Brennan Berry's implant surgery.
Excuse me, Dr. Rosen?
Rosen declined our request for an interview, so we tried to catch up with him outside his office.
Well, we've been wanting to talk to you about why patients are being paid to get surgeries.
Through his attorney, Dr. Rosen told us he has nothing to do with that Craigslist ad, and he has no idea who Carter is.
This is private property. These are not allowed to claim here.
He also told us all patients must sign this form stating they have not been paid to get the implants. As for Brennan Berry, 3 months after getting his, he overdosed after taking heroin mixed with fentanyl.
I came home and found him. I'm in his bedroom, and he was gone when I got here.
You saw him struggle with this.
You have to fight every day not to use or not to drink. They say it's one day at a time, but it's every second of every day. And he did. He fought it.
After he died, Debbie Berry learned her son was paid $1,000 to get the implant.
You don't pay somebody to have surgery. You don't prey on vulnerable people who are trying their hardest to stay alive and have a real life again.
Dr. Rosen's clinic billed Debbie Berry's insurance $59,000 for that surgery, but the plan was willing to pay only a small fraction of that. Rosen's attorney did not tell us whether the doctor hires marketers.
Your heart just breaks for Debbie and knowing what they went through. Brennan.
So they are scamming opioid addicts to get a surgery that clearly doesn't work. First of all, that surgery don't make sense. Y'all hear that? They put an implant in and it's supposed to curb the addiction. That doesn't even make any common sense. Does that make sense? If it makes sense to somebody, please put it in the comment section. I never heard of an implant that curbs your addiction. That doesn't make any sense. I'm serious. You know, so now you got doctors scamming people to get a surgery that clearly does not work. And they're dying from drug overdose anyway, like this woman's son. That is unbelievable. But I guess everybody is trying to take advantage and cash in on the addiction. Ladies and gentlemen, Narcan has been increased in price. So now they are going to price gouge if you want to use Narcan. So as the opioid plague continues, tens of thousands of Americans each year are using naloxone. And we know they come out and sometimes they have to come out several times in 1 week for the same person. And they administer the Narcan and then the person is taken to the hospital because the effects of the Narcan actually wears off in like a half hour. So in the hospital, they may have to give them some more Narcan before the person is released and able to go home. Driving the price spike, experts say, an ongoing surge of overdoses that boost demand for naloxone. So as long as there's a great demand for it, this is why they're going to justify boosting the price. Okay. Lack of competition, industry. So there's no other competition, no other people out here making Narcan. So these pharmaceutical companies, and you know what, y'all, to add insult to injury, the same pharmaceutical companies that put out opioids are the same ones that are putting out Narcan. What does that say? It says they don't give a damn about these people out here. They are just going to cash in on their misery. And that's exactly what these pharmaceutical companies are doing. Pharmaceutical companies have a lack of transparency in setting prices for drugs to counter the effects of opioids. The rising price of naloxone comes at a time that drug overdoses have become the leading cause of accidental deaths in the U.S. For those aged 25 to 64, opioids are involved in nearly 2/3 of those fatalities, according to the federal health data. The U.S. Census for Disease Control, the U.S. Center for Disease Control and Prevention estimates drug overdoses kill a record of 72,000 Americans in 2017, lowballing that number. U.S. roughly 10% from the previous year. Most of those fatalities involve prescription opioids, include OxyContin or Vicodin. The rise in opioid deaths, okay, as you can see, all the lines going up from 2000 to 2016. This is commonly prescribed opioids. The highest one is the fentanyl, synthetic opioids, and then the dark blue is heroin, all going up. Since 2013, an estimated 170,000 people have died from overdosing on both prescription and illegal opioids. That's roughly 3 times the number of U.S. military personnel killed during the Vietnam War. As a result, the demand for naloxone, a synthetic drug akin to morphine that reverses the effects of an overdose by blocking opiate receptors in the nervous system, has never been higher. Researchers with the Food and Drug Administration Center for Drug Evaluation and Research note in an upcoming report, rising demand has helped drive the price of naloxone up more than 50% in some recent years. The FDA researchers write in a study set to be published in the journal Addictive Behaviors. They estimate that the cost of one injectable form of naloxone has tripled since 2012, while another single dose formulation rose 244%. We don't have any mechanism to stop the manufacturers from raising prices. So these pharmaceutical companies can put this pricing in free, they can jack it up another $100 for Narcan if they really want to do it, because there's really no regulation that says they can't do it. Wow. The price of naloxone, which has been around in generic form for more than 30 years, varies depending on whether it comes packaged as an injection device, auto injector, or nasal spray. Products also come in different dosages, which can affect pricing, while individual manufacturers may offer discounts and rebates to some buyers. Okay, so the nasal spray, Narcan, a relatively new naloxone product, costs the same as when it was first introduced in 2015, but that doesn't exactly mean it's cheap. The drug cost $125 for a 2-dose cartridge, according to the website of Adapt Pharma, which has manufactured Narcan, but it is sold to Emergent Biosolution last week for $735 million. Wow. Wow. That's a lot of money. By contrast, the 2-pack Evzio, an auto-injector made by Kelio, comes to just $3,700 according to GoodRx. Health departments and first responders are typically offered discounts. For instance, Adapt often gave away the Narcan for free or for a 40% discount, $75 for 2 doses, to public agencies. In a post on Bill of Health, a blog run by Petri Flom Center at Harvard University School, nurse practitioner Stephen Wood noted that naloxone's wholesale cost is around $20 for a single dose. The cost of a 2-injector kit is $4,000. Oh my, $4,000? That amounts to a 680% increase from the drug's original price in 2014. $4,000? The cost of 2-injector kit. Oh my God, that is outrageous. You see how they're going through so much and spending so much on these addicts. I tell you what, they didn't spend a dime on crack addicts. The only thing they did spend money on was building new prisons for them. And the sad part is they're still sitting in prison, many of them from the 80s, because of Bill Clinton's 3 strikes, you're outlaw. But that's a shame. They are spiking the price of something that they really need in order to save the life of the drug addict out here. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.